So, talking about scientific Garbhasanskar, the word itself says that it is a science and art which is going to be developing together and working together. So, what is scientific Garbhasanskar? So, let's first talk about what is Garbhasanskar. So, breaking the word into Garbha and Sanskar, Garbha means fetus, the baby which is growing in the mother's womb, and Sanskar means educating the mind. So this education of the mind, that is the education of the baby, will be done by the mother in the womb itself. So it is the mother who is going to do this sanskar, or she is going to educate the baby in the womb. Okay. So continuing with Garbha Sanskar, it is a practice of few simple activities that contribute towards the mother's social, physical, spiritual, and mental well-being of both mother and child. So as we know, the baby's personality, it itself starts developing into the womb itself. But how does it develop? So it is developed by the influence of the mother. But the mother has to be physically active. She has to be physically fit. And along with that, she has to be mentally and peacefully, she has to be relaxed. Along with that, she also has to practice the spiritual activities. In the today's era, when the families are separating and there is no practice of the together living of the family, due to which the spiritual activity is lacking somewhere. But the power of the spiritual activity is that you get to know about the knowledge, you are more capable of producing self-decision. So practicing spiritual activity can be in any form. You can practice in your own religion. So Hindus can listen about the Gayatri mantras. The Muslim can read the Quran, the preaching, and everything can be done accordingly. But practicing spiritual activity is important because it helps mother in mental well-being, and also she can take her decisions. What are the salient features which we provide through our Cura Advanced Physiotherapy? So here there is a strict adherence to quality standards with clinical expertise. There is cleanliness and hygiene which is maintained. There is close monitoring of each patient which is done. And we use cutting-edge medical science technology to provide easy access to healthcare services. Services which are provided are, we will be providing you with educational program. There will be evidence-based practice done. Pre and post assessment before admission or before any planning for any protocols will be done for each and every woman. Antenatal exercise classes will be provided. Relaxation techniques which are most useful during your entire pregnancy, and most probably it is most helpful during your labor period. So it will be taught. Along with that, labor guidelines will be given. Postnatal exercise classes is given where you will be getting back to your prenatal shape. Then nutritional talk, the diet which is required, and the virtual consultation. So who all are involved in the antenatal care team? So there is gynecologist, there is obstetrician, there is women's health physiotherapist, there is dietitian, there is lab techniques, there are experts in ultrasonographics, and there is pediatrician. So why Garbha Sanskar is required? So it is like just the baby is growing in the womb, and after 9 months the baby will be coming in this world. So is this like this, or do you think the Garbha Sanskar is required? Can anybody tell me why Garbha Sanskar is required, or is it important to do it? Anybody? Okay, no problem. I will tell you. So positive thinking and positive attitude is one which enhances the mental and physical well-being of the mother. If mother is physically and mentally healthy, so then on only the baby which is growing in the womb will be healthy. Because it is the one that is the eternal bond which is created between the mother and the baby is all due to her well-being. So it is most important to keep all the surrounding, all the environment around the mother to be positive. So more the happy, more stress-free, more without anxiety, the more will be the journey of pregnancy will be more better for the mother and it will be more healthier. Along with that, it also decreases your physical problems. Physical problems like your back pain, your calf pain. So these are minute pains which every woman in her pregnancy complains of. So by practicing few of these domains, the physical problems can be reduced. Along with that, strengthening specific muscles and improving circulation. So if you're strengthening specific muscles, It will be helping you during your pregnancy, it will be helping during your labor period, and also it will be helping you after delivery. Because after delivery, the work will be more, because at that time, it will be the double phase of the mother. It's like you have to take care of yourself also and also the baby. So it has the double duty. So the muscles which are required to be strengthened has to be strengthened. So by Garbhasanskar, you will be connecting with your unborn baby, the womb, the baby which is there in your womb. It will be filling with body and also the positive hormones. If mother is happy, if she is stress-free, so all the positive hormones will be transmitted to the baby. So removing stress and anxiety is most important. And by this way, we can stimulate the baby's mind, and due to which the baby's growth, the baby's brain development can be done better. So there are different modules through which we can deliver this scientific Garbhasanskar. So one is communicating with baby. As you must have seen in every home, if there is a female who is pregnant, she talks with the baby. So that talking with the baby is the communication which she has created. It is the eternal bond which she has developed with the baby. And also along with that, relaxing and calm music will also be helping. So the calm music is that it will be giving you the soothing effect. So more the soothing effect it will be, more the mother will be relaxed. So it can be any kind of music. It can be a classical music. It can be any kind of melody, or it can be a soft sound which can be heard. At around 16 weeks of gestation of a mother's week of pregnancy, the baby starts listening. So the first sound which baby listens is around 16 weeks. So mother can listen to this soft music, but also at the same time, she should remember that she should not cross the particular decibels which can hamper the ears of the baby. So while relaxing and calm music should be listened. Along with that, she can read the books. She can read the spiritual books. She can read the books which can be giving her knowledge about her pregnancy, about caring of her baby, about breastfeeding. So such topics or such books which gives knowledge to her, which gives a relaxing effect, can be read. Pregnancy meditation. Meditation is one such point which has to be followed by everybody, because by meditation she will be relaxed. She will be in her calm zone, which will be helping her to get into her calm and calmness. Because during labor, you must be seeing that the females get too much hyper, and they are hyper because they are into the pain, and due to this pain their BP may get aggravated. So this meditation and this yoga, it will help them to calm down. They will help them to maintain their breathing activities. So during the labor, the females can remain more calm and they can progress more towards their normal delivery. Also performing spiritual activities. As I already told you that performing spiritual activity is always giving you a beneficial effects, because practicing religious thoughts and rituals is one which helps you in developing the powerful coping mechanism, because it helps you taking difficult choices. It helps you in taking the easy decisions. So practicing spiritual activities during pregnancy is good. But earlier in the old era, when families were together, that time our elder people, our grandparents used to give the spiritual activities. So through them, the Garbhasanskar was being done. But in today's, where the families are separated or where there is nuclear family, so these spiritual activities are lacking. So I will try to tell you that practicing spiritual activity during pregnancy is one of the best sanskar that you can give to your baby when he or she is in the womb itself. Along with that, healthy diet. Healthy diet doesn't mean that you have to eat for the double or you have to eat for the two people. As in Marathi, it is said that तू दोन जीवांची आहेस तर तू दोन लोकांचं खाल्लं पाहिजेस. But it is nothing like that baby is growing in the womb and she has to eat for the two people. Because although pregnancy increases your body's need for the calories and nutrients, but eating appropriate is more beneficial than for eating for the two people. So always remember that eat appropriate and not double the quantity. And most important is healthy physical fitness. So healthy physical fitness is most important for every pregnant female who is going through her 9 months pregnancy, because there are physical changes which are taking place. So these physical changes are some or the other place they are going to hamper or they are going to make changes in her body, and which can take little problem to her further. So to avoid this, she has to practice this physical fitness. So what are the advantages to the growing baby in the womb? What are the advantages for that baby? So these are the few advantages. That is, there will be normalized birth measures of the baby. There will be lower fetal heart rate. There will be more mature brain will be developed for the baby, and there will be reduced chances of developing any cardiovascular disorders. So these are one of the few advantages which will be for the fetus, or it will be for your baby which is growing in the womb, if mother is healthy, if she is practicing all the domains of the Garbhasanskar. Moving further, of all the rights of the woman, the greatest is to be a mother. As we know, a mother is only one who has the inbuilt quality, or she has given that power to give a birth to a newborn baby or to a new human being. So what are the advantages to her? So here are the following advantages to the mother. It will improve her sleep quality. Many females in pregnancy do complain that there is disturbed sleep or she is unable to sleep. So by practicing the few sanskars or by practicing a physical activity, she will be able to cope up with her sleeping quality. And also there will be reduced in the pregnancy related low back pain, since the muscles get more elastic due to the relaxin hormone in the pregnancy which gets increased. There are more chances that the patient may complain about the low back pain. So you have to avoid this. It will also help you in reducing the muscle cramp and swelling, which is most commonly seen in second and third trimester, due to which the female avoid walking for the longer period because there is swelling in the legs, there is muscle cramps. So this can be reduced. And also you have to prevent from the antenatal depression. So why does this depression comes? Because when there is first delivery or first baby who are going to take place born, the mothers who are going into depression, because sometimes they don't know what the body is taking changes place. Sometimes it takes time for the mother to understand herself that what is her body taking changes place, what is the womb or what is the baby's development taking place or not. Sometimes family support is not there. Sometimes she is not able to cope up with the changes taking place physically because she is not that physically strong. So this can lead her to the antenatal depression, which ultimately can be affecting her baby also. So you have to take care that the females don't go into the depression, because having stress and anxiety will ultimately affect herself and also the baby. Along with that, you have to maintain the healthy weight. During pregnancy, around 12 to 16 or 12 to 18 kgs of weight gain is followed to be normal. So normal weight gain can be done. Then improving your cardiovascular fitness, reducing the risk of preterm labor, that is preterm delivery. Then possibly reducing the duration of labor pain and more chances of normal delivery. The way through which the duration of labor pain can be reduced is by practicing few exercises, practicing yoga, practicing breathing exercises, so that you can be calmed down. Along with that, improving your lifestyle habits and early recovery from post-pregnancy. So how your lifestyle habits affects you very well know, because in today's era where the lifestyles are one which are taking us back, and most commonly the pregnant women are in tension that she won't be looking or she won't be getting back into her pre-pregnancy body. But it is nothing like that. If you practice things at a proper time, you can definitely recover and you can come back to your pre-pregnancy state. So by practicing physical fitness, you will go back, or there will be early recovery of your post-pregnancy. So these are few benefits from exercise during pregnancy. That is, the maternal weight gain will be maintained. There will be mental and physical fitness. Gestational diabetes risk can be reduced. Hypertension chances are reduced. Then there will be reduced pelvic floor inflammation and any kind of pelvic floor disorders, because pelvic floor muscle is one which has to be strengthened properly, because it is the one which will be useful and benefits, and it has to work more. So strengthening of pelvic floor is that much important. Along with that, it will reduce the risk of acute cesarean section until and unless there is an emergency. Reduce risk of prolonged labor and any instrumental delivery. Reduce the risk of preterm delivery, and reduce the risk of macrostomia. Macrostomia is average, the baby's weight is more than the average normal babies. So why antenatal exercises, or during antenatal pregnancy or during pregnancy, what are the exercises which we need to plan? So before going towards it, let's see how the body changes during the pregnancy. So does anybody knows how the body changes, or what are the changes which are taking place during pregnancy? Can anybody tell me? Anybody? Okay. So as we know that as the pregnancy...
weight gain will be there.
Yes, right. What else will be there?
We can even see the lordotic.
Right, lordotic posture is there due to a baby's bum is growing.
Yes.
Yes, very nice. What else? Okay.
Then for few ladies, we can even see swelling in the foot.
Yes, swelling in the feet. Very correct.
Round ligament will be painful.
Yes.
Due to pelvic growth.
Right. Absolutely right. Along with that, as the females, they have told it very properly that there is a weight gain. Due to this weight gain, there are the chances that woman's center of gravity will be shifting ahead because the abdominal gets enlarged. And also with the increased in the oxygen intake, because this oxygen intake has increased because it is not only the mother who is breathing, but through her breathing, it is the baby also who is getting breathing, right? So around 50% of more breathing capacity gets increased during the pregnancy. So the woman has to take that intake of the oxygen naturally by increasing her oxygen intake capacity. And that you can do by just practicing few breathing exercises. And also, as we had mentioned it earlier, that relaxing hormone is one which is increased during the pregnancy. So due to this relaxing hormone, the ligaments and tissues, they get more elastic. And due to increase in this elasticity, there is chances that she will complain about the low back pain and also due to the increased curve of your back. There will be chances that she will be complaining of the back pain. And also there is increase in the blood flow. So changing hormones.
Excuse me, ma'am. Even in few ladies, we can even see gestational diabetes, and even few ladies will be getting the thyroid.
Right. So it has to be routinely checked during your pregnancy. If she is having such any complaints, or the routine follow-ups has to be taken if the patient is complaining about the gestational diabetes or she is having any thyroid. Because starting appropriate time, proper medication is also that much important. Because there are chances that if you come to know about the diabetes and thyroid at the last movement, at the third trimester, there are chances that the patient may go for the cesarean delivery. So to avoid such complications, if the prior planning and prior medications and prior physical fitness is taken into consideration, so this complications can be avoided, right? Yeah. So further, talking about the posture of the pregnancy. So you must be told many a time that this standing posture is correct or this posture is not correct. You are standing wrong or you are standing improper. So let's talk about what is correct and what is incorrect posture. So you can see your two females who are standing. So the head posture which is there, so this head posture should be lifted. The crown of the head should be lifted and the chin should be aligned with the ears and the neck. Whereas the other girl who is standing, you can see her chin is facing downwards and the eyes and her ears are not focused in the line. So due to which she will be having the complaining of the neck pain because she is straining her neck muscles. So remember that it should be in the correct position. Along with that, the shoulders and chest. Due to pregnancy, there is increase in the breast size. So due to the breast size increase, there are chances that you may get rounded shoulders, you may hunch little. So due to which you are pulling your muscles forward. So you are lifting your rib cage. So to avoid this, you have to lift your rib cage. So you can use the belt. So here she has used the belt. So she is lifting her rib cage. She is pulling her shoulders back. So she will not have any complaint of the shoulder pain or neck pain or back pain. Whereas in here, she is having hunched shoulder, her rib cage will be restricted. And due to this restriction, she will be having difficulty in breathing. And due to this, the female complains that they are having difficulty while speaking or while they are walking, they are feeling little restless. This is the reason that due to the obstruction in the rib cage, there will be difficulty in breathing and also there will be difficulty in digestion also. So your posture matters a lot. Along with that, your abdomen, your uterus and your buttock should be tucked in so that the pubic bone is slightly forward. Here you can see the lordotic curve which is created. So this lordotic curve will lead her to the more backache. There will be overusing of the muscles. And also there will be overarch which is created will lead pressure on the bladder. So there will be frequency of more that you have to urinate. So many a time up to third trimester, the patient says that they have to urinate more because there is a pressure of the uterus which is coming on the bladder. And also the knee should not be straight. It should be bent slightly because the weight should not be going directly on your knees because you are compressing or you're giving more stress on your knee. So these are small, minute things which you have to remember and you have to follow accordingly so that you can avoid further going physical problems. So maintaining correct posture during pregnancy is most important. So guidelines for exercising during pregnancy. So these are basic guidelines which you have to follow before going for any exercise. First is taking orders from the doctors. If doctors give you the go signal or green signal, then only you have to start it. Whenever you are doing exercises, you should start with warm-up exercises and not directly going into any high workout because warming up of the muscles is most important. You should protect your belly by avoiding any activities which will compress your abdomen. So you should avoid such activities which will compress your abdomen because that will be harmful or it will be risk for your baby. You should never do your exercises or you should avoid sleeping in a straight on your back after your first trimester. Because when you're sleeping on your back, that time you're giving more pressure on your inferior vena cava, and due to which the venous return is affected and hence is your cardiac output affected. And this is the reason why you're having more swelling in your legs. So mostly after first trimester, the female should sleep on the left side. If you're sleeping on the left side, there are more chances that the BP issue, the pressure will be maintained. Next is keeping your body well hydrated. So there should be no dehydration or overheating. So proper water intake is must. Along with the water intake, consuming enough amount of calories which will support both in your pregnancy and your exercise is important. And also avoid contact sports or activity which requires quick changes in the direction. So always start with mild exercises and slowly you can progress it. These are one of the few basic exercises which you can practice during the exercises during your pregnancy. That is practicing your thoracic, practicing your shoulder exercises, arm slides on the arm, bicep curls, shoulder abduction, that is taking shoulder sideways, doing your thoracic extensions, doing TheraBand exercises, doing wall squats, push-ups, heel raise. These are the few exercises which will be helping you in training. Because your shoulder, your upper body is required more powerful, more strong, because once you are delivered the baby, you have to continuously hold your baby. So your upper body, your shoulders, your arms should be that strengthened. They should be specifically strengthened so that you don't get any kind of pain or ache while you're holding your baby.
Ma'am, even duck walking and butterfly exercises also we can do, right?
Yes, definitely. Duck walking is very much useful because it allows baby going downward. So you can practice duck walking during your pregnancy and while labor. You have to walk in duck walking. So your cervix dilation which is there, which will take place earlier. So the pain or the duration of labor can be reduced. And definitely this butterfly stretching which you are telling is also useful. It will be working for your abductors and also your pelvic floor muscles. So you have to practice both. And also Kegels exercises, that is the pelvic floor. So pelvic floor is most important. So you have to practice pelvic floor exercises during your pregnancy also and also even after your pregnancy. Because those are the muscles which will be acting. Because those are the ones which will be avoiding or once your muscles are trained, you will not have any chances of having any urinary incontinence. Because if you are having normal delivery, the baby will be coming out from your pelvic floor muscles. So if baby is coming from your vagina, so there are chances that muscles will definitely get weak. So if the muscles are weak, there are chances that you may have some leakage of urine. So many a times after pregnancy, the female complains that while she is lifting anything or if she is coughing or if she is laughing, that time few droplets or few times it dribbles the urine. So to avoid this, you have to practice Kegels exercises. You have to work on your pelvic floor muscles. Going further, which exercises are good during pregnancy?
Excuse me, ma'am.
Yes.
Is cycling preferable in the first trimester, like for 3 months at least?
Definitely, you can do it, ma'am.
Like till which month we can advise them?
Yeah, you can continue up to the first trimester. In second trimester also you can do it. Once your baby bulb is starting growing, it should not obstruct it.
Okay.
Handle which is
Then what about driving the scooty and all?
driving the scooty is comfortable. The distance between the handle and your seat is comfortable, then you can drive it. Otherwise, you have to avoid it. And even if you are driving, you have to take your seat back and you can continue it. So few changes or few modifications if you are doing while driving, definitely you can do it. But along with that, you have to take few precautions also.
Okay,
If the
the
mother
main
is
person
having
is
nausea
driving.
and all, I don't think the driving is recommended, right?
Driving is not recommended, but still in today's era when females are working till their last trimester, so do females drive, but do they take some precautions like managing their seat, they're taking it more backward, driving slowly. So few modifications you can do and you can continue. Otherwise, if it is not possible, so try to avoid it.
Okay, ma'am.
Yeah. So these are few exercises which you can do. So which exercises are good during pregnancy? So you can practice yoga, you can practice pregnancy antenatal exercises, you can do pregnancy stretches. So many a time patient says that when should we start with the ball exercises? So practicing ball exercises is recommended in all trimester because those will help you in your stability. It will help you in your posture. It will help you in your back muscles, your core muscles. So you can practice your ball exercises also. So practicing stretches, yoga is always beneficial for the female. Going further towards your labor period, so what are physiotherapy options which you can do? So first is relaxation. Relaxation can be done by breathing exercises, by relaxing your mind, by if you are in the labor room, you can imagine any soothing thing. You can imagine any park, you can imagine your home, or you can imagine any relaxing thing that you think of will calm down your mind. You can practice breathing techniques like you can practice diaphragmatic breathing, you can practice alternate nostrils. So these activities will help you control your breathing. And if you're controlling your breathing, if you're relaxed, so due to which the stress level will not be increased during your labor, and so is your blood pressure will be maintained. Because many a times due to your pain during your labor, the BP is shoot out, and if your BP is shoot out the mostly, then you have to land up into cesarean session. So try to be relaxed, try to be calm during your labor period. Along with that, there are pain relief techniques which can be practiced during your labor period. Proper positioning is also important so that the duration can be lower. The duration which is there can be shorter for the period. Also, other techniques like massage, warm bath, and TENS can be applied to the females to the back so that the pain intensity can be reduced. So this way, by practicing the breathing exercises or by practicing the relaxation techniques, the depression and the stress can be controlled. So mother will be more able to control and more able to focus on the contractions which are coming. Even your partner which is there during your labor period, he can accompany you by giving the back massage so that the contraction, so that the back pain which is there during the labor period can be controlled. So your partners can also play a playful role during this period. These are some of the positions during the labor which you can practice so that the pain is reduced, so that the duration is reduced, and so that the dilation of the cervix takes place much faster than the regular. So you can use chair if you're comfortable, you can use pillows, you can use your blankets, you can sit on the ball and practice such positions, which will help you to relax, which will help you to open up the dilation, cervix dilation. Along with this position, there are other positions which your partner can accompany you, and the partner can help you to reduce some kind of the pain and stress. So by holding the baby bump or lifting it, the pain can be, and the weight which is there, which can be reduced. Also, the duck walking, which earlier you have talked about, is very much useful during this period. So these are the few positions and few practice which your partner can help you So you can practice these techniques prior to your pregnancy or during your pregnancy period, so that during your labor period you don't panic, or you don't get hypertension, or you don't go into that stage. So these are few positions which you can practice. So these are few benefits which we are going to get, that are the benefits of working out during your pregnancy. So improving your cardiovascular fitness, improving your psychological wellness, that is prevention or improvement of the depression symptoms, which mostly females go through their pregnancy. So this rate of anxiety can be reduced. Improving your sleep quality, improving the severity of your back or low back pain. It also helps in easing your constipation. Your gestational diabetes can be controlled, or the chances of getting any BP issue or cesarean delivery can be avoided. Risk of urinary incontinence can be decreased. Improving overall general fitness, that is strengthening your heart and blood vessels, and also decreasing the period or the duration of the postpartum recovery time. So these are few of the benefits. Moving further towards the postnatal exercises or after delivery exercises, before talking about you, let's see what is the body which takes changes. So as we have talked about the changes which are taking place during your pregnancy, also after pregnancy your body do change, right? So there is stress, there is dropping breast due to the increase in the weight of the breast, due to the secretion of the milk, the breast will be drooping, your baby belly is loose, the skin will be loose. There are chances that female will go through the urinary incontinence, there will be bigger shoe size, there will be wider hips, there will be stretch marks, there will be lower sex drive. So due to this all physically changes, and due to this physiological changes which are taking place, many a times female do go into depression. She mostly avoids seeing herself in the mirror, because comparing herself the prior she was goes or takes her to more stress level. So females are mostly tried to make more happy, or try to influence them, or we can try to make them happy by telling them that yes, you can go back to your pre-pregnancy state also. So this is the period when the females mostly go into their postnatal or postpartum depression phase. So to avoid this depression phase, we have to practice few components, that is 8 hours of sleep. Supplements and vitamins which are required has to be taken. Regular walking can be started. Few workout exercises can be started. She can ask for the help from your family members, for her partner, so that she may get rest period. Proper and appropriate medical checkup. She has to take time for herself also. Doing the list things accordingly and eating healthy food. So these are few practices which she has to follow routinely. Along with that, there are some breastfeeding positions which are most important. So either you can go into the supine line, that is sleeping and feeding the baby, or in the sitting position, that is cradle position, cross cradle position, or football position. But you should remember that whenever you are holding your baby, so your baby should not be too down. If you're holding your baby on your lap, so you have to walk, uh, you have to bend more from your shoulders. So if you're bending more from your shoulders, you will have definitely neck pain, shoulder pain. So your baby should always be up. The baby should be towards your chest, and not you have to go down. The baby can be lifted up by placing the pillow on your thighs. So this will be appropriate position. And along with that, when you're giving milk in the sideline position, it is mostly not avoided. It has to be avoided, because sometimes when your breast is heavy, and when you're in the sideline position, so the your breast weight can hamper the baby. So it can block her respiratory system, and the baby can go into respiratory distress. Because sometimes while feeding position, the mother goes into sleeping position due to she is tired. So due to that reason, try giving milk in a sitting position and try avoiding into a sideline position. So this is postpartum posture, which mostly the females accompany to. This is due to the increase in a breast size. The mother goes into the rounded shoulders. There is forward head posture, and due to which there is strain on her neck muscles. Okay, so okay.
The PPT is visible.
Should I continue then? Okay.
What you can do is, sorry to interrupt, you go to the option where all of you are visible, right? There is the condition, there is an option to do mute and pin, and there is the option with 3 dots. You press that and you press full screen. Then you'll be able to see. It's in your hand to maximize or minimize the screen.
Yeah, okay, thank you. Okay, so we're talking about the postpartum posture. So in postpartum posture, the head and neck should not be, it should be in the proper angle, in the proper line, so that you will avoid the kyphosis posture, that is rounded shoulders. The ribs should not be slouched posture, so you have to stack your ribs also to avoid the breathing difficulties. So you can use the belt as well. The spine has to be neutral also, so that is proper weight alignment. So maintaining your proper alignment helps you maintain your physical fitness and also avoids you from getting any physical complaints. So if you don't follow all these protocols or all these domains, there are high chances that females goes into postnatal depression. So the research says that 1 in 7 women that have given birth experience goes through the postpartum depression. And the females who are giving birth for the first time, or the first female who are the first baby, they are having chances of having 7.3 times more risk of having postpartum depression. And also 10% out of which the fathers may also go into the depression phase. So what are the symptoms which then comes to know that the female is going through this depression? So there can be severe mood swings. The female may be sometimes happy, or sometimes she may get irritated too much. She may get angry too much, or sometimes she may go into the crying phase. There is loss of appetite. She is not able to sleep. There will be anxiety. There will be crying episodes. There will be changing her sleeping and eating patterns. So these all things are the one which leads her to the postpartum depression symptoms. So try avoiding this phase. There is a few physical activities for women after childbirth, that is up to birth of 12 months. So she has to practice it. So it will be helpful because it will be reducing her depression, her worries. It will be helping her into gaining pre-pregnancy weight. The muscles of the tummy, the muscles and the strength of the muscles which have gone, so the tone can be developed. There will be overall fitness can be gained. It will improve, it can enhance her mood, and also it can improve her sleep. So the target should be made of at least 150 minutes of moderate intensity activity, which she has to practice every week. So it is always safe to be active. So there is no any harmful effects of having any postpartum woman if she is practicing any of the physical activities. The only is that you have to follow it properly. So depending on your delivery, do listen to your body and do start it gently. So practicing and getting active as soon as possible, or as your body allows you, is most important. Along with that, practicing and strengthening your muscles twice a week is also recommended. Yes, doctor.
Yes.
Okay. So we were talking about which exercises are to be avoided immediately after your delivery, because your muscles are not that developed. That is your crunches, your planks, your push-ups, and heavy lifting. So these are the activities of few exercises which you have to avoid, because the muscles of your abdomen are not that developed that you will practice these exercises. Because if you're practicing these positions, these exercises, this will allow you to go into slower recovery zone. Along with that, exercises which you should practice is, you should do stability exercises like posture exercises, which will help you develop your posture. You can practice breathing exercises. Upper back strengthening can be started. And along with that, most important is pelvic floor muscle. So these are the few exercises that will have no harmful effect, but obviously it will have benefits to you. So this can be started. So this is the muscle. This is your pre-pregnancy body, this is your during pregnancy body, and this is your after pregnancy body. So as we know, there is the rectus abdominis muscle, which gets separated during your pregnancy, and after pregnancy, it doesn't comes into your back, or it doesn't get approximated immediately. So due to this position, or due to this separation of the muscle, if you're practicing heavy load, you're lifting heavy load, or if you're practicing such positions, which can definitely hamper the recovery. So to avoid that, you can use the corset You can practice slowly in engaging your breast. You can start with your core exercises slowly, progressively, with the appropriate knowledge of the doctor. So practicing such activities has to be avoided, and practicing proper form of core has to be started also, because working on your core will definitely be helpful, because you have to approximate this muscle also. So these are few of the postpartum core exercises which you can practice. That is 4-point kneeling, which will engage your abdominal muscle, leg sliding movements, knee raising, heel touch, and leg extensions. Along with this, there are many other exercises. According to the condition of your core muscles, according to the strength of the core muscles, the progression can be made accordingly. Before doing this, important things which you have to remember is every mom and every birth is different. So never compare yourself with anybody else. Her recovery can be different. Your recovery can be different. Your strength of muscle can be different. So is her. Also, exercising too soon after delivery or waiting for a longer period to exercise is also not recommended. So wait for a go signal from a doctor before trying any kind of exercise. Doing exercise is important, but also doing correct exercise at correct time is more important. So do follow this and do listen to this few attentions which has to be taken place before planning for any kind of exercise. So any doubts till now, guys?
Dr. Kritika, do you recommend any time slot like 3 weeks or 4 weeks after delivery to start the exercises?
Yeah, according to the ACSM guidelines, you can practice every week at least 3 times. 3 to 4 times is recommended. So accordingly, you can plan your schedule. You can plan your exercise protocol. Weekly at least 3 times.
I'm asking like how much time do we have to wait after the delivery? Like 3 weeks or 4 weeks? Is it recommended like that? Is it different for cesarean and normal delivery? Is it like that?
So if it is normal delivery, you can start from your 2nd day or 3rd day with at least bed exercises, bed mobility exercises. That is just maintaining your posture exercises, your ATM exercises, your leg exercises. But if you are having a cesarean, so you can wait for your removal of your sutures. But before removal of your sutures, you can do your upper body exercises, and along with that, you can start with your leg exercises also. And once you are okay with your removal of your muscles, removal of your sutures is done, you can start with slowly engaging your core muscles. So the core muscles first can be trained in the static positions, and later you can progress it slowly to the dynamic. So the rectus abdominis or diastasis recti, which has been separated, it will get into approximated. So slowly everything has to be progressed. And if you are comparing about the normal delivery and cesarean, so cardiovascular fitness or cardiovascular training, which we talk about. So in normal delivery, after your 5 to 6 weeks, you can start with the cardiovascular or aerobic training. And in cesarean delivery, you can start it after 8 to 12 weeks.
Do you recommend any exercises that are done with the medicine ball?
With
the ball?
Yeah, definitely. You can start with the ball. You are talking about during antenatal period or after delivery?
During antenatal period.
During antenatal period, definitely ball exercises can be done in your all trimester exercises. So sitting on the ball, maintaining the posture, doing forward and backward movements, doing trying to maintaining the position, involving your hands, then going into quadruped position. So in that also you have certain levels, certain progression can be done accordingly. So but ball exercises can definitely be done.
Ma'am, any diet plan?
Thank you.
Yes.
Any diet plan? Because during pregnancy, people say not to eat papaya like that, and some of the food restrictions are there. So is there any proper diet plan?
Yeah, for particular females, they've been told that you can eat everything, nothing will be done. But having appropriate calories and nutrients is important. So your diet, your plate should involve this particular portion, should be involving all the vitamins and nutrients or required calories during your period. So according to your investigations, according to your nutrients which you already have in your body, or sometimes there is deficiency of particular nutrients or calories. So according to that, the diet plan can be planned accordingly.
Okay.
Okay. Yeah, plank and crunches can be started once your diastasis recti, that is abdominal muscles are contracted, is corrected. Because once your muscle is into a position, then only you can do the crunches and planks, because it is high intensity exercise. So it is only recommended once your muscles are approximated, once your doctor checks the strength of your muscle, then only it has been recommended to start. See, every muscle has a different strength and different quality. So many a times the female will go back into her fitness after 3 months itself, if she was earlier practicing any physical activity. But if you are talking about a mother who was not physically active before a pregnancy, and then immediately if you are talking to exercise her after pregnancy, it will be difficult. So every mother and every muscle is different. So according to your muscle and according to the strength of the muscle, the things will vary, the months will vary. Yeah. In cesarean delivery also it is recommended, but also your muscles has to get approximated. The answer will be the same. Once the strength of the muscle is developed, or it has that capability to hold your positions of your doing Pilates or doing the core muscle strengthening. Because core muscles can be activated, but it has to be activated position, and then it can be progressed slowly. So starting directly to the planks or crunches is not always recommended. So you have to go slowly. Yeah, if you are taking proper medications, if your proper medications are continued during the gestational diabetes or thyroid, there is no harmful effects of doing exercises. So definitely you can continue with the exercises. The only thing is that you have to take proper guidance of the doctor who is practicing the exercises. So proper form of exercises can be practiced.
Actually, Dr. Damit, actually people say if we have hypothyroidism or hyperthyroidism, it is advisable to do exercise.
Right.
So there is no harmful in that, because even during gestational people get thyroid and later on it will subside, and in some people it will remain like that. But exercise is must and should for them, even if they have thyroid or diabetes.
Right, ma'am. See, if you're eating daily seafood, or if you're used to having non-veg, so there is no any harmful effects of having meat or any kind of different seafood. So whatever, and according to your religious and according to your state, or according to your everyday eating daily routine of your food, the diet can be according to the person or according to the individual plan. So if you are okay with having your seafood, so definitely you can continue it. But if you're not used to it, sometimes the female doesn't suit it according to their moods and according to their nausea or according to the symptoms. So that time those females are told that to avoid these things. But if the food is suitable for you, so you can continue eating it.
Dr. Zamir, one last question from my side. Dr. Kritika, I just want to know if the same exercise protocol goes for high risk pregnancies, or there are some precautionary measures that has to be taken with people who are on the high risk side during the pregnancy.
Precautions need to be taken is that the monitoring will be carried out. That is the heart rate or the pulse rate, which has to be monitored while doing the exercise. The female should not cross above 140 beats. The heart rate should not cross while she is doing such exercises or any kind of physical activity. So while doing any kind of exercises, routine monitoring is necessary for her. Before exercise, after exercise, she has to maintain her proper vitals. Yeah, definitely, Dr. Dominic. We do provide teleconsultation, and that can be done through video conference or through audio calling also. So do we provide your services also?